business continuity, how are we going to continue? It was said the other night that we can never have this happen again. Never's a long time. Am I a mask advocate? Am I an advocate for having closed everything? No, but early on, those were the steps that were best identified. I think we could have responded sooner and started changing those policies. But again, we didn't know what we didn't know, and we had to start figuring out how that was going to impact our communities. We were caught unprepared for something that would spread the way this did, and the goal was never to eliminate the spread of COVID. The true goal was to keep the hospitals from being completely overwhelmed and shutting down health care as we know it. And I can tell you, I was on calls every day 1 year ago, 13 months ago, in January, with hospitals thinking they were going to have to implement crisis standards of care. We're going to have to make tough decisions on what we're doing. And fortunately, that stopped pretty quickly, middle of January. And we were able to start then really making some course adjustments. So I think it's following the science, taking politics out of it, and understanding the data.
Thank you.
Those who ignore history are doomed to repeat it. We did something, I don't want to say we. I had a clinic that the first thing I did was start calling all of the manufacturers of rapid antigen tests. I wrote letters. I got a call back after an email at 1 hour from the regional director of Sanofi. And he said, that's the best written letter I've seen. You requested an analyzer. I said, yes. He said, I'm sending you 3 to deploy. Thank goodness. We were the only clinic in the region, private clinic, that had rapid antigen testing. We had people coming from Illinois, Nebraska. I've got the charts. Arkansas. We went from about 50 patients a day to an average of 150 patients a day. Our staff can't handle that, so what did I do? I called in favors, called friends. I marshaled people. We went from 1 provider a day to 4. We started hiring high school students as greeters to get people's numbers outside. So we managed, but that's reactive. To address the question, we need to do an after-action report. See what we did right. See what we could have done better. Not finger pointing. We learn by looking back. Every EMS I know has a plan for disasters, different kinds of disasters. The fire department, when I worked at St. Luke's, building on fire, we knew we were going to have multiple casualties. We have a mass casualty protocol. So I think we need to prepare for that. We need to involve the community to see what extra resources we could have if our plan isn't adequate. I was around in H1N1. I remember when 75 people came through my clinic that day. I called all my paramedic friends and said, look, I'll pay you 15 bucks an hour. Just come up and do vitals. Come up and help us get these people through there. I walked out in the lobby. I said, everybody will get seen within the next 2 hours. Be patient with us. Those paramedics wouldn't take the money. We involve the community. When the community is involved, they don't feel scared and helpless. So in planning for future ones, I think we need to anticipate what are they, who's already got a plan, can it be applied here? We've got the 11th largest county in the state. We should be able to have a response that meets, because our county is sort of unique. We've got a urban and a rural. We have to look at the big picture. We just have to plan for the future on that. So I think we take a look at history, we plan for the future, and we put contingency plans in place that involve the community.
Thank you.
Oh, I'm sorry. I get to be last.
I apologize.
No problem. So when this pandemic first started, I was in a leadership role, and we had to determine what we were going to do with patients who were chronic patients coming into our clinic. They're seen weekly. They have chronic wounds, they're high risk for amputations. We had to determine, what are we going to do with these folks, because we're told to scale back our clinic visits. We can't have all of these people in our clinics and our waiting rooms. So from the beginning, and hindsight is 2020, right? We now know what we know. But I looked at that and I thought, these people are very sick. They have conditions that could kill them. And we made decisions then to keep them in their homes and not have them come for their doctor visits. And that was the decisions made, not by me, but as what I was told from leadership to do, try to scale the visits back. I think now, from what I know, and what I see in healthcare, we are very crippled in healthcare. We are COVID admissions are not what they used to be yet. I have a patient in my clinic that I need to admit to the hospital. They may sit for 8, 9 hours or 24 before they get a bed. And the reason is there's no staff. There's nobody to work in hospitals. So we have to think ahead at how we're going to prepare. And when we're thinking that, we have to make sure that we're treating people appropriately for the condition that exists. What is it? What are we dealing with? And making a plan. And we have learned through COVID that the plan of having people just stay home wasn't quite the best plan. So now we know, and we learn from that. We go forward, we use that information, and we make sure we're treating all conditions for all patients. I think the actual issue with COVID is not only just that disease, but the outcome of other chronic diseases that maybe got pushed to the back burner for patients, and we're still trying to catch up. So making sure all patients are treated and preparing for those situations, making sure we have the proper things we need in place and that there's a plan in every hospital, and be ready. I recall being told we don't have masks, we don't have this. So.
You don't have any idea how hard it is for me to sit up here and not nod my head in agreement with what some of these candidates are saying and remain completely neutral after 35 years in the public health business and seeing everything in every corner of the world with diseases you've never heard of before. It's difficult, candidates. I know you must think I am frozen, but I'm remaining neutral to what you say. Perhaps not in my brain, but in my aspect. Question number 3. Mental health is an important component of the Platte County Health Department. In light of recent gender fluidity policies in other parts of the country that impact our young people, what is your view on the overall health and future mental health impacts to our youth as it pertains to gender change decisions made by parents for a young child that does not yet have the capacity to make clear decisions about gender identity or even who they are, or for that matter, what they are? That's a long question. I repeat it if you need it to.
I'm going to pull on Michael and stand up. Great idea. This is a very, very intense question. As a parent of gender fluid children, this hits home, and it hits hard. So, that being said, I was fortunate to have one made a decision. To me, it's not even a thing, but it is a thing. It was right in my face. I got 3 minutes, right? So that being said, I was fortunate that my oldest was over 18, made a decision, did some therapy, got some help. The younger one happened under my watch.
It was frightening, difficult. We went through the steps of therapy, etc. That being said, I think it's really important for the health department to have mental health services for gender fluid individuals, but not just them. It's also, people who have suicidal thoughts. This world, there's so much media impacting our children. But yeah, if it's going to be addressed in public health, it should be starting at a young age if the child feels like they identify with a sex or yeah, I apologize.
Obviously, mental health overall is a huge concern throughout the country. And working in the hospitals, our emergency departments are full every day. That is a time-consuming patient in our doors. It's resource-consuming. We apply a lot of time and effort in dealing with that. With this specific circumstance, it's obviously a societal question and it's looming. But I think as a health department, our role and responsibility would be working with the school districts, working with the community in large, and helping to identify resources and directing people to that. I think there's very little that we would be able to do policy-wise other than supporting the health department and identifying those resources, working with school counselors, working with outside agencies to address that. And I don't know if mental health is going to come up, but again, I think that that's a huge concern going forward. There's not enough resources. There's not enough hospital capacity to deal with those inpatients. We're implementing things such as 988 for emergency calls to be able to deal with behavioral health concerns. And this is just another one of those issues that is going to increase that demand and make it more challenging for our youth.
Thank you.
A great orator once said, you have to be absurd to illustrate absurdity. I'll be blunt, and I'm not going to sound like a doctor for a minute. If I had a child with diabetes at school, I think there's absolutely no role that their teacher or counselors have counseling them about their diabetes. Mental health is a medical condition. Only licensed providers should be allowed to cuss and discuss those issues with our children and adults who need that kind of counseling. I think we need legislation to restrict that. Well-intended people try to help people. But if we define a gender crisis as a mental health problem, no different than diabetes for a child, we need to be proactive. Find the best ways for those people who need help. Some of them don't have good family support. School counselors get involved. But once they realize it's a gender issue, that's where it should stop. We need professionals to handle that issue. Mental health has touched almost everybody I know. Every family has had some kind of brush with it, or extended family. We have to have better resources. We have to have better ways to identify when our resources aren't enough for one of our Platte County citizens and have a plan what to do next.
Thank you.
I'm going to ask you to repeat the question again.
Yes. I've been asked to repeat the question. Mental health is an important component of the Platte County Health Department. In light of recent gender fluidity policies in other parts of the country, that impact our young people, what is your view on the overall health and future mental health impacts to our youth as it pertains to gender change decisions made by parents for a young child that does not yet have the capacity to make clear decisions about gender identity or even who they are, or for that matter, what they are?
Okay, so granted, I have not worked at the health department for several years, but I did work there. And I don't believe that anyone working in the health department as a nurse should be doing any type of counseling with anyone that is dealing with a question about their gender or gender issue. I believe that it would be the role of the nurse or the employee of the health department to make that referral to a mental health provider to determine what the next steps are. And to include the parent in that decision, to discuss that with the parent. If there are mental health issues and there are issues surrounding that, the parent needs to be included in that discussion.
Thank you.
While working at the high school, mental health was it exploded in the 14 years I was there. When I was first there, it was kind of there, and then it grew, and it grew, and it grew. And suicide was a big issue for a while. And to tell you the truth, and then now, more recently, it was the gender, and I would have students that would say, I need to be called them. I'm not a she, I'm a him. And I would respect when they told me that, because that's not I didn't feel it was my position to argue. That's what they wanted to be called, that's how we work. But even with the suicide issues and the gender, I didn't feel like I was the qualified person. I was there to listen, and I would refer to a counselor or a social worker. But I also believed, and even if I had a pregnant teen that was younger than 18, it was important for me to get the parent involved. It's the parents and the child's decision, and maybe with counseling. Very important to do that, but also for me to respect the person.
Thank you.
Oh, I did one more comment. I wanted to make one last comment. I apologize. I do not think it is the right of the counselor or the nurse or the social worker to work with a student that is under the age of 18 to work toward things. I think the parent needs to be involved. If the student is 18 or older, we truly don't have, at least in the state of Missouri, the right. I mean, if that student wants to look into gender changing and whatever, that's their right.
With the advent of video, medical support, and home delivery of groceries and medications, access to these important needs has been greatly improved. However, there is a segment of the population that does not or cannot utilize these options. Within the transportation segment of the Platte County Health Department, what is your position on additional transportation options for disadvantaged populations, the elderly and infirm within Platte County for access to health care needs, grocery shopping, and pharmacy?
Well, I would admit I don't know what resources they currently provide, so I don't know that I can speak to what direction it would need to go in the future. Part of the discussion on the first question we had on the location of the health department, putting it on a bus line, making it more accessible, I think is part of an effort. But if there are people who can't get out and have those needs met, there are resources, and again, the health department can't provide all of those resources, but they are a collection and gathering point. They can help share that information, I couldn't be more proud. I happen to work for one of the safety net hospitals, and we deal with that population group as much as anyone, and looking for ways to make those resources available within their community and getting that information out there. The major task of the health department going forward is working in a community-based partnership and identifying the social determinants of care, identifying what those vulnerability gaps are, and working on ways to improve it. While the health department doesn't own all of that, again, they are the focal point of helping to identify those resources and make that information available to the community and the people they serve.
Thank you.
I plan to be a little less enthusiastic. I get emotional sometimes, and if it offended anyone, I apologize. The Platte County Board of Services for the Developmentally Disabled currently has a fleet of vehicles because we have group homes, and these are folks who don't have typically normal schedules. They need rides to work, they need other rides. So that's a unique population. But the population of Platte County in general, I think the health department has a duty to identify some of these needs. And as he said, we can be a central locating point. My mother used to go out and take meals to folks. We have volunteer services. I think we need to get all the volunteer services, Meals on Wheels and other things. And I think we would have a fiduciary responsibility to the citizens of the county to coordinate all of these volunteer services, because it's a win-win scenario. Our citizens get what they need, and those volunteering get satisfaction in giving. So I really think that we have to look at the role of the health department. We have to make sure it doesn't get overexpanded to the point of doing other things that really aren't within the scope of that. It is to ensure the safety and health of the citizens of Platte County. If they can't get food, they come to us. I think we ought to have a resource ready to go of who can get involved, because a lot of these groups are there at a volunteer basis. We shouldn't take that away from them. There's you just get feeling good inside when you're able to give. So to address that specifically, I think we have some similar answers up here, but that's what I would make sure we did regarding that.
Thank you.
In my current role where I'm at, in my position, I see every day transportation to and from appointments is one of the biggest challenges for the people I serve as a nurse. I spend a great deal of time planning and creating a plan, trying to garner support for patients and getting them to and from what they need. I would think that the health department's role in that would be to have appropriate referrals to services that can provide transportation. I think that we have to be very careful about expanding our role to become the transportation service for patients, but we need to have appropriate referral sources to get them what they need, each patient. Unfortunately, we can't cure every problem, but we can look to those who provide those services. And getting an appropriate listing of those folks that do that, it will be helpful to the patients.
Thank you.
To be honest with you, I don't have any really different answer than what you've heard. I don't think you can bog down the health department to be able to do everything, but I think it would be very, very rewarding and, well, not rewarding is really not the word, efficient to have resources that we can look into. And the social workers, if I didn't have my social workers at the high school, I would have been sunk. Because, and when I first started at Parkhill High School, they had no social worker, and we ended up, after 14 years there, having 2 social workers. and the knowledge that they carry. So I would hope that the health department has social workers that are there and have these resources. And I also love the idea, there's many people in Platte County that want to volunteer. A lot of them are looking for things. What can I do? What can I do to help? And if that could be something for transportation and for our communities, I think that would be an excellent idea.
Thank you.
If the Platte County Health Department were to provide transportation for patients and goods, a lot of things would probably be an added cost, because it's not just like the automobiles, the assets, it would also be insurance. And I can't help but think that, we got to be careful who the drivers are. I agree with the panel that outside resources that volunteers that you can refer to be the ones that kind of help carry that load, because it is an added burden. To me, it seems to be outside of that scope of treating the patients both physically and mentally. But yeah, if the health department can find like volunteers, other resources, I think that would be beneficial and maybe not as a liability.
Thank you.
If I come to a surprise to you, but I actually went, I'm not from Platte County. I think that's one of the reasons why they asked me, because I don't know diddly squat about Platte County. In fact, I drove right past the community center. But I did go to the Public Health Board's website. And so each of these questions that you're being asked are asked within or under a banner that's on that website. So each question is part of what the Public Health Board addresses on their website. I didn't want you or the audience to think these questions were coming from somewhere out in the left field. They are all within the purview of banners or radio buttons on the website. Next question. The county and its citizens are always mindful of the cost of providing services. Operating budgets and categories of service are an important part of recommendations that come from the board. How would you balance sound public health, boots-on-the-ground needs against the administrative and brick-and-mortar costs to maintain the highest level of health, safety, and welfare to the community?
Well, if you run your own business in healthcare, you have to be efficient. You have to make sure you address the most needs, the fewest dollars. I think we have to look at the needs and look at what the measurements of the needs are, and we can deploy assets and find ways to fund those in the most efficient way. That's a really simple answer to it. Sometimes you're going to have to get more staff. Sometimes we could use Zoom calls. Sometimes if we need more staff, we need to look at how many staff we have on duty each day to take care of the patients who come into the clinic. I don't think it makes sense to have 6 nurses on for 12 patients a day. But that doesn't happen in a private clinic, because we just can't afford it. We need to treat the money like it's our own business. If we run a surplus, we do. But I think we ought to have things like sliding staffing schedules. If we have a rush, we have a high-capacity protocol we can put in place to bring people in. If there's a sudden surge of needs, we have a protocol we have to address those if we have to make a home visit. But those are needs we need to anticipate, and I think we have to look at the overall operation of the health department in its entirety to find the most efficient way to use the money, because that's what we're really charged to do.
Thank you.
So everywhere that I have worked as a nurse, there has always been a staffing grid or a decision on using your staffing their assets to you. So with regard to the health department, we need to look at metrics, what we're doing, how many patients we're seeing, and base that on what our needs are. And what materials we need based on the amount of patients we're seeing. I have not seen a private hospital, I've worked in many, that we don't continue to have the same amount of staff just because we have that amount of staff scheduled for that day. If we need more staff, they're called in. If we have less patients, staff are told to stay home and they're not needed. So we must do the same with our public health funds. We must look at what we're providing service-wise and what we need to give as far as staff and supplies and assets. We are currently, I looked at the services provided for primary care at the health department. The numbers are down, and they have been down since COVID. Now, whether or not that is a result of the clinic closing for some time due to COVID, and people found other providers, but this is something we need to look at in the future. If those numbers continue to remain low, what is the future of primary care at the health department? So that's something to look in the future. Maybe these patients will be coming back. What do we need to do to get them coming back and resume their care? And where did those folks go? So from here on out, we need to be paying close attention to those things.
Thank you.
Now that we have, and that we're going to have to deal with a new building that is probably over budget, and then now we're going to be looking at staffing, and it's so important to kind of look at that with your clientele and how many visits you have and that type of thing, because the budget isn't, we all have our budgets, and we have to stay within our budgets. And if we don't stay in our budgets, we go more into debt. Yes, we want to provide everything for the patients that we can, and it would be great to have those things available every day, but if we don't have the clientele coming in for those services, we're going to have to cut. And we're already looking at probably a budget overwhelmed based on the building. And I'm not pointing fingers, I don't want to point fingers, but it's something, it's reality, we have to deal with it. And we're going to have to figure out to get that within budget so that the taxpayers know exactly what we're doing. But I think we owe it to the taxpayers not to overstaff, provide services, but maybe base it on what the activity is.
Thank you.
I guess maybe the best way to answer that question is to compare your budgets. Look at the budgets for the past 2 years. We don't include 2020, part 2021. But look at the budget from the past year. Divide up the quarters. Determine the number of patients coming in, how much it costs. Look at your payroll in that period of time. Predict what. I mean, when I say quarters, sometimes I think there'll be more traffic on certain seasons than there would be on others. So kind of take a look at that. Look at those numbers. Try to set a budget. Try to adhere to it. But make allocations, extra funds, in order for anything different or an anomaly that might appear.
Thank you.
The health department is governed by a 5-member board that's elected. It's not managed by a 5-member board. The health department employs managers, directors to run the health department. They're provided a budget. They're expected to stay within that budget and understand that, again, we are going to be facing a very difficult financial future for a while. Likely we are over budget on a building, and we're going to have to make sure that we continue to focus on the core tenets of public health. there's a lot of opportunity for scope creep and to start addressing things that don't fall directly within the responsibility of the health department. And the state of Missouri is working on new plans for focusing the attention of the health department and identifying where they should place their time and efforts. And the responsibility of the elected board is to assure that the state plan aligns with the community needs, aligns with the social determinants of health, and that we're providing those resources in the most cost-effective and efficient manner possible. And while I don't think I need to sit there and micromanage a budget and know every dollar that they're spending, are they spending it within their budgeted amount, and is that budget reflecting what the needs are for the health department?
Thank you.
This question comes from an audience member. What should the main goal of the health department be for its budget?
I'm sorry, you'll have to repeat that question.
I'm sorry. What should the main goal of the health department be for its budget? What's the main goal for the budget? I don't know if that's proposing the budget, managing the budget. It's the question that I have.
For the health department or for the board?
It says, what should the main goal of the health department, well, I'll read it exactly as written. What should the main goal of the health department be for its budget? I assume that DPAT means department.
I would say the main goal would be to remain within the budget. I don't know how else to answer that question, is to remain within the budget and to be reasonable about that and not try their best to not exceed that. I really don't know how else to answer that question.
I guess I would say just the main thing would be to take care of your community and take care of your community to the best of your ability within the budget.
That's, I hate to say it, it sounds kind of vague. I guess it really depends on what metrics you're trying to hit. Is it going to be, existing, I'm saying within the existing services, or how about, is there a budget for improvements regarding the building or services that we provide? I think I would need more clarification on that.
Thank you.
I think I'll reference back to my previous answer. We're obligated to provide certain resources, and we have certain core functions that a health department is obligated to do, and the budget should be built around being able to address those needs and then staying within that budget.
Thank you.
We're elected to oversee the health department. Yes, they have a budget. I believe that a board should also hold the managers and the directors to a level of efficiency in employing the services. And I want answers as to how they're doing it. Some people might think it's micromanagement. Do it in my business every day. I'm the owner. Am I just letting them run with the budget? I want to know, are you doing everything you can to be most efficient? I think that's a role. If it's not been the role, that's why I'm running. I want to make it the role.
Thank you.
Another question from the audience. What do you feel about the access to the department for people in North Platte County? What do you feel about access to the department for people in North Platte County?
Well, my understanding is that now we'll have a bus route, but do the buses go to North Platte County? I don't think, that's probably a rural area. So I guess the mid-location of the new building is closer for them, but again, you're going to go back into some transportation issues in helping those people get to the mid-building. That's all I could say.
Thank you.
Driving out here and comparing it to where the new location of the health department is, to me, it still seems far. It still seems a bit far for those who need those services. From someone who has private health insurance, I can go anywhere pretty close by. Someone who doesn't have that luxury, it's a long drive.
Thank you.
I think overall it's the Platte County Health Department. And while moving the building is going to move those resources further away than what they are today in Platte City, not all of the service line was available in Platte City. If you needed clinical, you were more likely going to the Parkville location. So depending on what services you need, those may be closer or further away. I think that, again, maybe looking at some satellite days of operations somewhere. But again, COVID has changed a lot. We can do a lot more through telehealth visits and everything else. While that may not be available to the entire population, we probably have the opportunity to start utilizing technology to prevent people from having to go to one fixed location.
Thank you.
Platte County's pretty big. It's obvious that we will use telemedicine most efficiently, but when people need to be physically there, say for vaccinations, assessments, physical assessments, not ones you can do through the screen. I agree, we need to find ways to make it easier for them, because let's be frank, a lot of the folks who utilize the health department services are fiscally not in the same category as those folks who are going to drive to a main large-scale clinic, and they've got plenty of resources for that. I think we need to look at do a resource assessment of the folks in North Platte County. Find out what the challenges are. Send them a questionnaire. Have them send us email messages about what they think their needs are. Look at it and find the best way to address it at that time. Because I know we're going to utilize technology, but I'm going to address the question when they need to be physically seen. I don't like how far that is, knowing that I have a clinic and a lot of folks from North Platte actually have come up to ours because it was shorter than going south.
Thank you.
I believe that it was nice to have the Platte City location for the folks that live in northern Platte County. It was easier to get to, transportation-wise. People can find their way to Platte City a little easier that live in this area. They typically do probably a lot of their grocery shopping, other activities there in Platte City, so that was helpful for them to have that clinic. With that being said, I understand the idea of putting one location to combine the services and the staff. But I think that maybe sometimes we need to look at, I know they do this with immunizations, is they do satellite clinics, or they do clinics in the schools to give flu vaccines or any other vaccines that maybe that maybe the parent would not have to transport the child that far, and they could be done at school. So continuing those activities are important in getting services to individuals in the county.
Thank you.
Another question from the audience. Are there services you would like to see added or taken away from the health department? Are there services you would like to see added or taken away from the health department?
I cannot think of any at this point.
Thank you.
Again, looking at the budget, attending the meetings, there's a lot of discussion about their use of the clinics and providing primary care services. Those are underwhelmingly used, but coming out of COVID, which has really changed the access and delivery of health care, I think at this time, I think the health department's current plan is to get into the new location, see if that changes any of the use of services, and then make changes based on that. And I think that's a fairly sound idea. See what that need looks like, and then make adjustments based on that.
Thank you.
Because it's a moving target, we need to continually assess the needs of services at the county health department. One year we may have a large need, and one we have a little bit lower need. I think we need to consider also seeing if there's a role to partner with maybe private clinics that would donate their time in a certain geographic location to provide a unique service to an individual who has transportation difficulties. But I think getting back to the question, I don't have the data standing in front of you today to say, this one goes, this one should stay. I think that's going to be a year-to-year assessment, and we should be making those assessments year to year. And sometimes if we have to go biannually, we should.
Thank you.
I think, and I guess I will second what Dr. Chaffee said. We will have changing needs every year. This is not it's not a constant that this is the only thing we're going to do, or this service will always be there. Maybe next year, that's not a service that the health department would offer. Whatever service it might not be, that maybe it's not getting used by the majority of people, so why would you keep the service? So I think assessing each year what we need, what services need to be added or changed. I feel like the health department always has the opportunity with every visit to educate their patients. That should be the most important role for the health department. And I know they're starting, through a grant, they're getting naloxone or Narcan in their clinic. And so that will be a good opportunity too to educate patients when they come in, discussing issues with opioid. So that may be something to look at in the future too. And I know that's kind of a grant situation that's up and coming. I think that's our next biggest crisis that public health is going to have to deal with, is opioid addiction and fentanyl. And that's continuing to be a problem. And I know it's one of the leading causes of death for 18 to 44-year-olds. So that's something to look at.
Thank you.
Yes, I do agree that we would have to assess the needs every year in terms of what you, of how you do things. Like, it may be mental health one year, or I guess you'd have to look at the county of Platte County and see where the most need was. And sometimes you're backtracking because that might have been from last year, but it probably would go on a little bit to the following year. And it's just data driven. You have to assess and keep following up on what you did and staff in those needs and provide that staffing in those areas where the most need is.
Thank you. question from the audience?
Define government overreach in relation to the Platte County Health Department.
Well, the health department is governed by statute on what they have to do. So I think that they're obligated again to provide the core tenets of public health. It has a elected 5-member board that governs it. Right now, I think there's politics going on that are occurring from other places within local government in the county. And I think the health department, again, has a board in and of itself to run the public health department for the county. So it's separate from it should be separate from other political influences, and needs to work cooperatively with those other entities to identify what the needs are and to address them, but the governance is provided through this board.
Thank you.
I believe the governance is provided by the board. However, historically, that has not been the case. Example of government overreach, I will tell you, is when the government influences the board members to make decisions in the interest of them and not the citizens. Example, Dr. Kingsley, who was on the board, made a passionate plea to make the mask mandate optional. He explained the data to the board. They declined. He said, well, you're going to be doing it soon anyway. 3 days later, Johnson County repealed their mask mandate, and an emergency meeting was called by the Platte County Health Board to discuss that decision. Unfortunately, the media had to get there because he was told it would be voted down. But when he presented data, facts, in front of open-minded people who appreciate science, I think he was able to convince everyone that was a good idea. That's an example of overreach. When the mayor of a city communicates with the board members of another county, that's overreach. If the governor would call us and tell us what to do, that's overreach. We appreciate input, but we're not going to take marching orders. That's overreach.
Thank you.
Government overreach, I would define as the health department has their basic tenets of what they need to do to keep people safe. They make recommendations. They encourage people to do things that are important to their health, that are positive, have a positive impact on their health. It's not the health department's role to mandate or enforce any of the rules that interfere with people's liberties and freedoms, to attend their church service, to go to and from their job if needed. So yes, it's important to protect the public health of others, and we need to make sure we're doing that, but we have to have a healthy balance of protecting people's freedoms too. So as long as those are balanced, there won't be government overreach.
Thank you.
When I was the school nurse, we always listened, and during the pandemic, what does the CDC say? What are they saying? What we have to remember is the CDC cannot mandate. They do not mandate. They provide recommendations. And that is up to individual liberties. Yes, there's a list of all the vaccinations that kids need, and the CDC recommends them. But if a parent chooses not to have their child have those vaccinations, there are exemptions that the parent can themselves do. We don't limit them from not coming to school. They just would have to have the exemption card signed. Individual liberty is very important. Mandating to a community, to me, is just, it goes beyond the Constitution. And I believe in safety for the health of the citizens of Platte County. And if they want to wear a mask, by all means, wear a mask, if that makes you feel safe. But I also saw a lot of children and teenagers, and the mental health skyrocketed with those masks on. So not only, there's just a lot of issues that under mandates, I don't believe in mandates. Put it like that.
Thank you.
The government overreach, that's the federal government overreach, correct? Not
It just says government overreach.
government. Okay, so I think speaking from, when it comes to like federal, yeah, I personally thought it was a bit much. I think the state should be able to determine what is best for, you know, and a lot of that should be determined, I think, at a local level. The national mask mandate was, I think, a little bit much, but I understand that you're trying to cater to a lot of people who have that fear. So, yeah, sorry, now we're going to answer that one.
Thank you.
So if I was on the board in March 2020, what would I have done? Well, you can get on the internet because there's an interview with Lauren Halifax in March of 2020 when I sort of addressed this already, but I'll do it here. In the beginning of a pandemic, you're not sure what to do. When SARS-1 came out, I was medical director of MCG Medical Center's emergency department. When my chairman said, "What are you doing about this?" I said, "I'm pulling all the smart people in to advise me." I think we needed to look at best and worst case scenarios. Was it going to be another H1N1? Was it going to be another SARS-1? But more than anything, I think we needed to prepare for this and look at what were the recommendations of the CDC, would be the recommendations of the CDC. I don't think the CDC or someone else recommends sending officials of the county to close a church while leaving a liquor store open. I think people should be allowed to get their spirit where they want. I think coordinated efforts with subject matter experts need to be brought in early and look at best and worst case scenarios. Find the best way that we can communicate, decrease fear to the public, have a consistent, unbiased line of communication with the people. They need a source. Sure, you can get it on whichever channel people watch. We have a duty to our citizens. And I look at that duty as though, as a board member, I would look at the county as a patient. We always have to do what's best for the patient. There's a Latin term that all physicians subscribe to. It says, primum non nocere. Of greatest importance, do no harm. So, with that in mind, we can look back, and as I mentioned earlier, a lot of lessons learned. That if we have a lot of unknowns, instead of being afraid and panicking, maybe we should prepare for all scenarios and reassess as we go with the best plan we have for any of us.
Well, hindsight's 20/20, right? We would all do things a lot different if we had it to do over, right? So I would think that maybe in 2020, I think about what I was doing then, where I was working. I followed the guidance of our local hospital where I worked. I did what I was told. I followed what they said. With time and with what we were seeing occurring, we need to make adjustments and changes to best fit what's going on. And that's what the data that we receive with the current information we're receiving. So we can't really just say we're going to do one thing and leave it that way for 6 months, because COVID was something that was a constant changing situation. We all did what we were supposed to do, I think, in the first couple of weeks. We listened, but as time progressed, I think many people started to question. what's going on, and we needed to protect the people that were most vulnerable. I think that's probably the biggest thing you could have done differently after we figured out how this was rolling out, how the disease was progressing, is we were starting to note that many elderly people with comorbidities became very ill, and younger people seemed to do okay with it. They maybe got the illness, but they recovered. So I think once that was determined, we should do our best to protect the most vulnerable, but let the younger folks continue on with life, go to their jobs, do what they need to do to get by.
You,
If I could inject some humor here, at age 76, the government defines me as elderly. So if panel would please be careful using the word elderly in my presence, it would make me feel a lot more comfortable. Right now, I feel vulnerable.
you asked what I would have done differently, and I'm going to ask, what did I do, and how did I react? Very confused, thinking, this is so different. We're reacting different. We're not using our common sense. We're not using science. Wear a mask. Put plastic partitions up. 3 feet, 6 feet. Oh, so the virus isn't going to get you at 3 feet or 6 feet. And so I struggled with all of these decisions. And what did I do, and probably what would I do for the next one is I went to different research. Yes, I was listening to the CDC, and I'm thinking, gosh, that's different than what they've said before. And so I would look at articles. I would look up about masks. I would look up, I'm going to say these 2 drugs, and it's dangerous what I'm going to say, but ivermectin, hydroxychloroquine, they had been great drugs, old drugs that we have utilized with our public and other countries have used. But man, if you said those words, you were nuts. And they didn't used to be nuts. They were wonderful, wonderful drugs and have been around for many years. And so I guess, again, I'm just a nurse. I would definitely go to the research. I would study and look at the data in our community and then make a decision. And I felt that's what I did for myself to try and understand what was going on.
Thank you.
If I knew now what I knew then, what would have been done differently? Personally, I'd probably be less scared. Second of all, I think maybe we can assess really how bad this can be. So those who are most vulnerable are probably better to wear a mask, stay at home, let the younger people go out and take care of all the things that need to be done. Sorry, I don't know how to answer this question too, but I mean definitely I think maybe less fear, less politicizing, I think. Though I don't know if that was unavoidable because not many people agree. You got some who are super scared and then some who are just bold and says, you know what, it's a virus. Either it gets in you or it doesn't. But I think how we reacted was right in the event that because we didn't know what it was exactly. But I think knowing now, I think we could have been out a little bit more, but taking precaution to protect those who are vulnerable to this.
Thank you.
Again, and I believe the question was if we knew now what we knew in 2020, what would we do if we were on the health department board?
Yes.
And so my answer would be, I was responsible for a lot of those decisions at my employment. I was the safety officer for the hospital. I had to work closely with those in other departments that had influence over it. So our occupational health was tasked with ensuring the safety of our workforce. I had to work with patient safety, who was responsible for ensuring the safety of our patients. And I can tell you dates very vividly. They're etched in my memory forever. February 26th, we implemented our Code Delta, our disaster plan, because we knew something was happening. We had to start getting ready for it. We started looking at what are our policies and how do we change our policies to address a evolving situation. And it was very daunting because it was a lot of policies that were going to have to be updated because we knew supplies were going to be challenging. And so we thought, how do we write these policies to reflect all of that? And then it was, oh, we have a policy that says that already. It's our emergency operations plan. If we declare a disaster, we can start to change those policies. March 14th, first patient is identified in Johnson County. They're close in the area. And then March 20th, we have our first patient at the hospital. The following Monday, we had 17 individuals who had contracted it. It was obvious it was community born at that point. We implemented mask mandates within the hospital. We were the first hospital in the region who did that. On calls that day, I was asked, why are you doing something so aggressive? It's not warranted at this point. By Wednesday, all of the hospitals were doing that because it was obvious that those were probably going to be what was protecting people. And I can tell you, closing the hospital was never an option. We had to protect people so we can continue to do our business, which was caring for people. We had zero transmission today of COVID from a patient to a healthcare provider. Zero transmission that we know of. We had plenty of employee-to-employee transmission when they weren't following the rules, but we had zero cases from a patient to the employees. So could we have done things like that and encouraged it more in the public and not have to shut things down? It's obvious that some of those efforts were effective, and we could have probably prevented huge problems down the road.
Thank you. There's one question remaining. Did you answer?
I did.
Oh, he did.
He started, I was,
Okay.
I don't have such a good memory. I think I went first.
I think you did too. And you confirmed it. There's one last question from the audience, and it was directed specifically to one of the candidates. But I will address the question to all 5 of you. The question is simply, why running?
Why am I running? Well, I have been a nurse for a number of years, and I no longer have any of my children at home. They are moved on with their life, and I have grandchildren. I have 3 children, 2 live in Platte County. My 3 grandchildren live in Platte County. So it's very important to me that the county's a healthy place to live, and that it's a good place to live for my grandkids. So really, that's my biggest motivation, is public service and making sure that for future generations and for my own family, it continues to be a wonderful place to live.
Thank you.
Well, I've been a nurse for over 40 years, and I retired full-time a couple of years ago, and I've been subbing in the school district. But I still have some energy to be a nurse and to take what I've learned in nursing and move forward. And I believe in service, and I thought when I heard this position there were some positions opening up that I could maybe go in a different direction and provide that opportunity to use my knowledge to help in the health department and for the citizens of Platte County. I would be honored to have that position, and I would work very hard. So,
Thank you.
I started my life here in Kansas City area, Kansas City Northland to be exact, working in health. I took a break to be a stay-at-home mom. I started working for the family business. The opening came up, and I would love to have an opportunity to be part of working with the health department in another capacity outside being an employee. I'm better behind the scenes than I am in front of everybody. I feel like I can be good at oversight, budget, and things going on. I would love the opportunity, giving me a chance, but that's what I want to do. And I truly believe that a healthy Platte County does make a prosperous Platte County.
Thank you.
If there was a opening on the library board, on the sewer board, on the water board, I wouldn't apply. That's not where my experience is. That's not where my expertise lies. I've spent 30 years in healthcare. I've spent a number of those years as an elected official. I understand the core tenets of public health. I understand the need of networking and being part of a larger region. I understand the politics. I understand preparedness is one of the core functions of the health department. I lead that in the region. I have those networking. I believe I have something to offer as an elected official to this board in doing that. And I only applied my skills and talents to something where I think I can contribute the most.
Thank you.
Wish I could just say ditto. A colleague of mine approached me who was not happy with how things were being run. He knew we had just sold our businesses for money that we could immediately retire on. And I said, no, that's okay, I'm not going to do that. When I got home, I talked to Heather. And that evening I realized that I spent 15 years in scouting. Why? What did I learn from scouting? Scouting is about life. And there's a lot of things about life. And it was being selfless versus selfish. And yes, when you have a skill set of business operations, management, networking, entrepreneurship, and responsibility, fiscal, ethical responsibility. Those were three things that I said, I've done it in the private sector. Done it well. My wife probably wants me out of the house a little bit more because I'm there a lot now. But I thought about it and I said, I've been very blessed in my life. If I have something to give, I should do it. And it's not about me. I'm running to serve to the best of my capacity. And I think I have the credentials and experience to do so. My conscience wouldn't be clear if I didn't go ahead and attempt to serve my community in this fashion.
Thank you, candidates, for being open and transparent in your answers. And thank you all for coming tonight. I appreciate being asked here to moderate tonight. I want to thank the host, which I guess is the Dearborn City, for offering its building. The only thing that I might suggest next time, I've viewed similar events like this on television, and I've noticed that the moderator is usually seated near a coffee table in an overstuffed chair. So if I might suggest to the next moderator you have here that you perhaps look for a chair and a coffee table and then perhaps a cup of coffee. On the other hand, you've allowed the candidates to be seated during this whole time instead of standing for 2 hours. So that's a good thing. Thank you so much for having me, and thank you ever so much for coming. You're exercising your freedom of thought and your freedom of expression. And my alarm for 3 minutes is going off.